Do you want me to stop?
No, you're good.
Okay.
So if anterior palpation, again, make sure you're doing ipsilateral side. Be very careful any sort of crossover, etc. Okay. With the male, if you're palpating 16 to femoral triangle, you can just say, do you mind moving over, moving your stuff over, look away, they will move it, and be done with it, okay?
Magic.
We've done it before, all right? It's not a big deal for us. All right, so again, let's use the belt line as sort of a landmark, never underneath the clothing, no reason to. Spandex would be ideal, but shorts are fine too. If they are wearing jeans, so like a general population, you can have them take their belt off. The belt is sometimes hard to palpate through. So is denim, really annoying. So if they're wearing jeans, have them take off their jeans. Kidding! And if they're wearing jeggings, just kick them out of your office because they shouldn't be there anyway. That's a weird view.
Yeah, I didn't know what you
That's
wanted.
I don't want. Find me a straight anterior.
Definitely not that one.
All right. So anterior superior iliac spine, belt line, easiest one to find. Okay. So on the anterior surface, these are going to be our easiest landmarks to find. Okay, they are quite prominent. You might actually be able to visually see them too. Anterior superior. All right, now, because the pelvis flares, sort of at an angle, anterior inferior is going to be slightly medial and slightly medial, slightly inferior. All right, so they're not straight up and down. So to get anterior inferior, oh, by the way, when you're on anterior superior, if she flexes, there's sartorius. All right. If I come out to the side and she abducts, there's tension fascia lata. Agreed? So I actually got multiple there. And if I'm really good, I can actually palpate right here. Inguinal ligament. Okay? So anterior inferior though, I'm going to be here again, ipsilateral side, slightly inferior, slightly medial, and deep. So I'm way down there. There's anterior inferior. This should be rectus femoris. So again, if I have her do a straight leg raise, there it is. There's rectus femoris underneath my finger. Does that make sense? All right, so anterior superior, anterior inferior. For pubic bone, pubic tubercle, pubic symphysis, this should be a patient palpation. So what I usually do is have them put their hands like this. I want you to start your belt line and slide your hand down until you feel the bony prominence. And they will be able to feel it, okay? If you do it on yourselves right now, you'll be able to feel about a couple inches below the belt line, you'll feel the bony prominence. If she's palpating that, if you want to, because you're trying to get tenderness or elicit tenderness, is it okay if I palpate on top of your hands? Keeping her hands there, I can just simply come through, put pressure through, just to see if my pressure elicits pain. Not actually really trying to palpate per se. Now, there are some conditions, and depending on how you work with your patient, you can actually palpate the pubic tubercles to see if you're shifted or sheared or calipered. But you got to make sure that you have the trust of your patient, you know what you're doing. Again, I would never do that on an adolescent. And I've actually never really done that on any other patient. But you can, in theory, palpate the pubic tubercles and actually see if they are shifted or sheared. That kind of makes sense? Right? But if she were to put one hand on her pubic tubercle, other hand, please. All right? And I have one hand on her anterior superior iliac spine, that's her inguinal ligament. So actually I can come right here, I can palpate that inguinal ligament. And then I can come just a little bit superior to it, get in the soft spot, and get femoral artery. I am going to use her hand as protection. Okay, so that's going to shield me, so I know where not to cross, and I have no reason to ever come over midline. Right? It's just all about communication and making your patient feel comfortable that you're palpating. If you don't have to palpate these sections, don't go there. Right? The only reason I would ever palpate femoral arteries is if I'm worried about losing sensation. Right? If she has an ACL sprain, I'm not coming up here to palpate femoral arteries. That doesn't make any sense. Okay? Questions? One thing when we're in this area here, I'm actually going to have her go sideline, so if you can go and face that way. In a sideline position, it actually is even easier to palpate some of these structures. So what I can do here is almost like a C. I can come on top. That's iliac crest. I get the entire wing of the ilium here, right? I can use one finger. There's anterior superior iliac spine right there. I can come back here for posterior superior iliac spine. I can palpate all of that right there. If I come in here in the outer ala or the outer wing, This should be all gluteus medius and minimus. Agreed? There's gluteus maximus coming down to the lateral leg with the iliotibial band. So you can do a lot here in the sideline position. If they're having trouble staying balanced in sideline, give them a kickstand where they would just bend their bottom knee and kind of give them a little bit wider base. That's fine too. Okay? That makes sense? I would suggest if they wear these type of shorts, etc., and you're in a facility such as this, I would actually spin her around. Her legs are facing that way. So if I ever had to lift her leg or do like an abduction or something like that, just for her modesty, she's facing away from other. That makes sense? Questions? All right, let's do the anterior pelvis. Here we go.